I'm Tim Sheehy, president of the Metropolitan Milwaukee Association of Commerce, and I'm joined by my co-host, Dr. John Raymond, president of the Medical College of Wisconsin. On Monday, Wednesday, and Thursdays at 3:30, we deliver a 19-minute fact-filled update on the health and economic impact of COVID-19. The program is powered by Aurora WDC. Our special guest today is Christine McMahon. She owns a consulting and training firm and is the founder of the Leadership Institute of Wisconsin. Prior to starting her business, she worked for Procter & Gamble, Slim Fast Foods, and Nabisco, and knows the essential ingredients for creating a culture where people are given the flexibility to perform at their best. And I've asked Christine to share some insights and strategies as you all address the challenges of navigating COVID-19 with your employees and customers. But first, let's start with an update from the weekend with Dr. Raymond.
Thanks, Tim. Good afternoon, everyone. This first slide covers COVID-19 diagnostic testing. We've administered 272,000 cumulative COVID-19 tests in Wisconsin, of which 52,693 were reported in Milwaukee. Of those, 253,000 of the tests were negative, and 18,543, or 6.8% of the tests in Wisconsin were positive. 7,800 of those tests were reported in Milwaukee with a 14.8% positive test rate. And the highest single daily total of reported tests was 12,869 on May 29, 2020. Our testing capacity remains stable today at almost 15,000, with 56 laboratories currently testing and 31 in the pipeline planning to test. Of 3,492 COVID-19 tests reported today, there were 140 positive in Wisconsin at a 3.9% positive rate and 49 in Milwaukee. And the previous highest daily positive tests occurred on May 29th. Was 733 in Wisconsin and 477 in Milwaukee. Next slide, please. This next slide covers COVID-19 hospital metrics. The number of cumulative hospitalizations from COVID-19 to date was 2,603. That means you have about a 14% probability of being hospitalized if you have a positive test. And recall that we started out at nearly a 30% hospitalization rate. So that's improving as we expand our testing to patients that are less symptomatic and as we learn more about how to treat COVID-19. Currently, there are 403 inpatients in Wisconsin hospitals with a diagnosis of COVID-19, and that is stable. Our previous high was 446 on April 9th, and our recent low was 298 on May 6th. We currently have 136 patients with COVID-19 in intensive care, and that's stable. And there are 395 available ICU beds, which is also stable. Our ventilator capacity remains adequate and is stable. And with regard to PPE, the most critical current need is for gowns, and otherwise it is stable. Next and last slide, please. This slide reviews various COVID-19 indicators. There have been 595 deaths in Wisconsin and 281 in Milwaukee thus far, attributable to COVID-19. The breakdown by race and ethnicity is as follows. Black or African American deaths were 148 in Wisconsin, or 24.9% of the total reported deaths, and in Milwaukee, 124, or 44.1% of the deaths reported in Milwaukee County. There were 400 white deaths in Wisconsin at 67.2% and 123 in Milwaukee, or 43.8%. Hispanic and Latin deaths were 9.4%, or 56 in Wisconsin, and 28, or 10% in Milwaukee. And you'll note that the totals exceed 100% due to overlap between Black and African American and Hispanic and Latin categories. Doubling time for positive tests in Wisconsin continues to extend out now to 20.7 days and 2.3 days in Milwaukee. The growth rate of positive tests also has been stable at below 5%, now at 2.5% in Wisconsin, 3% in Milwaukee. And then finally, the reproductive numbers have gone down somewhat at 1.03 in Wisconsin and 1.13 in Milwaukee. And recall that ideally, we'd like to see that reproductive number be below 1. And thanks again, and I'll turn it back over to Tim.
Thanks, Dr. Raymond. It seems like we're getting closer on the reproductive number, but we still can't get below 1, can we?
Not so far. And, you know, we had 3 of our highest testing positive days last week, with 1,700 positive test results between Friday or Thursday and Sunday. So, you know, we always have reporting issues early in the week. So it'll be interesting to see what we see on Tuesday and Wednesday.
Thank you. And I know you'll join us for questions in a couple minutes here, but let's bring Christine back. And Christine, let's have you talk a little bit about the work that you do to help companies with their culture and flexibility and being able to perform. And I don't think anybody's seen anything like this in terms of testing the culture of a company, both in terms of dealing with their employees, but also dealing with their customers.
Yeah, it's this is unprecedented, and we're all talking about the fact that it is. I like to use the acronym that our military created. We're living in a VUCA world, and what VUCA stands for is the V is for volatility, the U is for uncertainty, the C is for complexity, because there's a lot of different factors in this, and we're all trying to figure it out together. And the last is the ambiguity. And when you think about each of those aspects, it creates a culture where people are getting up, they're wanting to do their best, but there's a part of them, either every day or at some point during the week, where they're in fight or flight. And what happens is, from a leadership perspective, we're used to dealing with the mental and the emotional side of people, but I don't know how many of us are really prepared to engage from a leadership perspective of dealing with the physical reaction of sustained heightened fight or flight and what happens to people. And in the surveys that we've studied and just in general inquiries, you ask people, you're like, how are you? And it's not uncommon to hear them say, I'm so foggy, I just can't even think. You know, I got out of bed, I got excited, I was sitting at my desk and nothing happened. I was just shut down. And in the middle of the day, I have to go take a nap, or I just can't think, or I'm depressed, or I'm sad, or I'm frightened. So this environment is now demanding from leadership a different aspect that I don't think many of us are prepared to handle, because it really requires that as leaders, we have to be compassionate, we have to be kind, and we have to be caring.
So how does this translate into kind of dealing with your customers? I was reading over the weekend in the New York Times, a lot of businesses that have had really close, I mean, physically close reactions with their customers. You can think of a food store putting out samples, all those kinds of things. And now we have a very antiseptic environment that we need to operate in. That's also stressing out companies and creating challenges to how they deal with their customers.
No question about that. And I don't think that there's a perfect answer to that. I think what it is we're all trying to figure it out together. I mean, if you were to imagine, and I was sharing this with Eric earlier, that, you know, if we created an agenda as leaders and said, we want 90% of our people to be working at home by the end of the year, there would be multiple meetings, there'd be multiple strategy sessions, and probably somewhere 9 months into it, someone would come and say, we absolutely can't do it. That's a ridiculous idea. Why would we want to do it? Yet we pulled it off in 48 hours, right? So one of the things we need to be doing is thinking as leaders, how do I look at my business differently? What is it that I can do? And everybody is adjusting to it. And thank you, Dr. Raymond, for giving us, and thank you, the MMAC, for giving us a playbook of how do we help employees return back to work safely. I think for any leader, they have to have an anchor. And what I mean by that is there needs to be a theme around this. And, you know, the theme is really safety. And there's a lot of employees who are coming back to work or refusing to come back to work because they're scared, right? And so what we want to do is we want to create some level of predictability, the best safety that we can, and as leaders admit the fact that we're not medical professionals. So we need to take the guidance of what you, Tim, and Dr. Raymond and others are saying. This is the playbook, this is how we operate, and there's nothing more important to me as a leader than you coming to work and leaving in the same condition that you're in. So we have to learn how to work differently. And I believe in us, and I believe in our capability to do it. It's not going to be as fun as it used to be. It's not going to be as supportive in the way that we're used to, but we're creative and we'll figure it out. And we've got to do that together. So in terms of customers, one of the things that's really critical is you need to have a game plan of how your sales organization is going to go to market. You've got to be prepared for customers saying, I don't have the same budgets that I've had before, and not have your salespeople want to give away all the profit margin, but rather to have a percentage that they're able to negotiate, and then how to unbundle or rebundle different options so that no isn't a full sentence, but rather it's an exploration of how do we do it, or how can we create a payment option that's viable for you, because you do want to hold on to as many customers as possible. You want that market share.
How do you address, because you do along with the alignment, the sales strategy, I think one of the most challenging things is going to be an environment now where it's very difficult to meet face-to-face to sell. How does that translate into a strategy?
Well, I'm going to tell you, the clients that I'm working with right now, they're having no problem with it because it's widespread. It's not the exception. Everybody is doing exactly what we're doing. And quite frankly, I have a client right now that has a 2-year backlog. Figure that out. In this environment, they have a 2-year backlog. Why? Their salespeople got on right away, and they were keeping in touch with their customers, and they were looking at what the budgets were going to be, and they were helping them to identify what they could do and what they couldn't do, and how to reinvent, if you will, how they purchase, and to capture the budgets that were available as soon as possible. And it's working. So I don't think that you're going to get the same resistance as you would 6 months ago. Everybody has some tool that they're using today.
Yeah, I think you really struck a chord on the safety. Polling we did last week still shows us that 72% of people are concerned they're going to get COVID, or they're concerned that somebody close to them is going to get COVID, and only 49% feel comfortable coming back to work.
Correct. And that's not a surprise. I mean, the big surveys that are being done now, I think it's exactly to your point, less than 50% say I'm going to come back at the end of summer. I'm going to test it out, see if it works. If it doesn't work for me, I want to stay home. And there's other companies saying stay home until January, and we're going to figure this out, right? Nothing more important than safety first. The challenge is for those individuals who work on the manufacturing floor, right? That's a big issue.
So what would you say is the #1 threat to alignment in a company?
So a couple of different things. The volatility that I talked about in the VUCA really needs to be the vision. And that vision, I think, should wrap around a really powerful metaphor that people can understand. And as I was thinking about our conversation here today, Tim, I was thinking, what would I use? And what I would use is probably the caterpillar who goes into the chrysalis. We're in the chrysalis right now, right? This is COVID. We're isolated. We're insulated. We're communicating via technology. But if we maintain ongoing focused communication, supporting each other with clear vision, what is it that we can do? Because there's a whole bunch of things we can't do, but what can we do? And how do we emerge the butterfly flying together and capturing market share and profitability? How do we do that? You've got to be, as a leader, asking those questions, and then collectively developing a game plan that everybody understands and also can contribute in their own way.
So Christine, stick with us. We'll bring Dr. Raymond back in, and Chris, let's go to questions.
Yeah, thank you. Our first question could be for Christine or Dr. Raymond. It may be a little early in this process, but are either of you aware of any good studies or data about how being essentially stuck safer at home for 2 months has changed our behavioral health?
Well, I'll just start by saying that the isolation has been a problem for many people. And, I think Christine already touched on how people feel disoriented, foggy, in some cases almost without purpose. And that's been a huge challenge for all of us. And it's going to continue, especially because you had mentioned the fear that people have about resuming normal activities.
And Tim, you may be able to speak to this, but I believe that Manpower has recently done a study. I haven't read it, but I think that they were conducting it. And I know that Northwestern Mutual is currently in the process of collecting their information. So I think it's a function of just a couple of weeks, maybe 3 weeks or so before all that information is gathered and is available. In terms of the behavioral health, off the top of my head, I don't have a great study for you. You might want to try Deloitte. They usually are on the cutting edge and have done and usually do really great studies. So whoever asked the question, you may want to go to their website.
Great, thank you. Another question for Dr. Raymond. Given the national conversation we've been having over the past several days about racial disparities, both nationally and here in Milwaukee, what do you think the COVID-19 crisis has taught us about racial disparities in Milwaukee, specifically about our healthcare system?
Undoubtedly, there are issues within the healthcare system that need to be addressed, including inequitable access and unconscious bias of some providers. But I think the problem's more a reflection of the many contributors to health, especially the social determinants of health. And at the end of the day, those are as important or maybe even more so than the quality of healthcare, behavior, or genetic predisposition to various diseases. And what I mean by social determinants of health are stable housing, living wage jobs, excellent education, safe neighborhood, nourishing food, and all of those lead to better opportunities and better health.
Chris, I'm going to just use that question as a quick opportunity here to highlight our webinar tomorrow from 11 to 12. And as we've watched Dr. Raymond kind of talk about this for the last couple months, African-American population in Milwaukee County is about 27%, yet they make up about 44% of the deaths. So if you talk or just listen to what Dr. Raymond just talked about, and then we think about the unjust act that occurred in Minneapolis over the weekend, we've got Nicole Robbins, the executive director of the Martin Luther King Economic Development Corporation tomorrow, and then two African-American business leaders, Clifton Phelps, who's the vice president of JCP Construction, and Kevin Newell, who is the CEO of Royal Capital Group. And we're going to talk about not just the demonstrations, the peaceful demonstrations, but what we can do to keep moving Milwaukee forward so we have an equitable community for all as we move out of COVID and we see its impacts on our community.
Yes, thanks, Tim. For Dr. Raymond, we also had a few questions about whether you are concerned about a spike in cases given the protests over the weekend and some people participating in the protests not necessarily wearing a mask or observing social distancing. And if I'm going to a protest, should I be wearing a face covering?
Yeah, great question. And as you know, I've said multiple times before, the one thing that you can do to protect others is to wear a cloth face covering, and to protect yourself and others would be social distancing. And so I do have a high level of concern, not just because of crowding and the fact that many people weren't wearing face coverings, but we know that African American and Latino populations and other disenfranchised minorities not only have a higher likelihood of getting the disease, but many have worse outcomes, especially African Americans. So yeah, I'm very, very concerned and troubled by the potential for a spike.
Great, thanks to all three of you, and thanks to everybody who asked a question today. If you want to register for tomorrow morning's webinar, the link is in the chat panel right now.
Christine, thank you for the advice. We really appreciate it. Dr. Raymond's always a pleasure. And we'll be back with you on Wednesday for an update, and it looks like some travel advice. So again, have a safe and productive rest of your day. Thank you very much.
Have a great day. Thank you so much, Tim. Yeah, thank you.